I'm David Mason, the Director of Public Health for the town of Sandwich, and we're doing our COVID PSA. We're going to call it number 1 for our second wave that we see coming now. And I'm sure a lot of you have seen the news and what's happening in the country and what's occurring as cases rise. We are seeing it here also, and Chief Burke's going to update us on the number of cases as of today.
Okay, thank you, Dave. Good afternoon, everybody. Active cases as of today, the 12th of November, is 15, and we are trending in the levels that we were in early to mid-April, which is about 6 months ago. The age group is younger. We're seeing it in all ages, especially college age, again, which has been a recurring theme throughout the summer. But again, the good news is, as of now, there's only one person hospitalized in all of Cape Cod for COVID at Cape Cod Hospital. There are no ICU admissions at this time, but again, the numbers are back up to the April levels. And again, part of it is spread, part of it is testing, which was non-existent back then. But we are definitely in a second wave, which was predicted back in the summertime, and we're just starting to see it right now here.
Chief, you had pointed out the chief does a daily update report to the COVID team, and you had just pointed out that the daily caseload in Massachusetts, I was rather shocked to see the report on that. It's up over 2,000 cases, but that's a high since
April the 14th.
Gotcha. So we are seeing that resurgence at this point. And, you know, and as far as seeing that reemergence in the community, it becomes increasingly likely that we will see community spread. So you'll hear us speak to issues regarding that as far as how to protect yourself. You're fully aware, but we're going to remind you anyways, and with upcoming events, how to handle certain things. But I know, Chief, that arrangements were made. You had flu shots going on today with the public health nurse.
Yes, so the flu shot program, which we started in early September, was around mid-September. We did the first drive-through at the wing school. I think it was the 15th. Then we did October 7th. We did our second round. That was for the public. We followed that up last week with municipal employees, and we finished today with public school employees that wanted a flu shot. So we've completed that initial program, which we set out. That was one of our early goals, and we were able to achieve it in a timely manner.
Perfect. Very good. And also, I mean, it's been a while since we met. We have not met for, I mean, as far as presented here, for a bit, just because we had a lot going on and not a lot to provide you at that time. But we also did retesting of employees also. Correct.
So the 9th of October, we did our 120-day municipal employee antibody check. We found 2 additional employees that had IgG antibodies, which are the long term. So at some point between May 20th and October 9th, they had contracted the virus. They were both asymptomatic. They did not complain of any illness over the summer. They were following up with their primary care physician, but the other 150 municipal employees, including my firefighters, all came back good at that point.
So we've stated this before, we're the only community that's open to the general public, and to date, we have not, knock on wood, we have not seen any cases directly associated with our employees. So which shows that the measures that have been put in place and our employees are being smart. So. One of the things Chief mentioned as far as the age group that we're seeing, originally in the beginning of, in March, the age group that was most impacted from the virus was those 60 plus. That is flipped. We're seeing ages now 0 to 19, where we're seeing a higher case rate with the age group of 0 to 19 years, which speaks to the fact, one, with school being open, and two, even though we've been very proactive in our schools, identifying cases and isolating and then quarantining direct contacts. We've had a few, but we've managed to control those immediately. But the big concern as we're in the month of November is Thanksgiving. You want to speak to that, Chief?
Yeah, so again, the concern is the large gathering. So what CDC is saying and the state is saying, and the evidence is out there, that it's home spread right now, meaning it's within the home that we're seeing this transmission. So trying to keep the Thanksgiving holiday, as much as we like it, down to a minimum. And I've said in my household, there'll be 5 of us. We have little bubble pods in my family. There'll be little groups of 4 or 5 that'll be celebrating, and we're doing takeout from Marshland here to support the local businesses. But that is a concern. I think when you throw in the college students coming back for a significant period of time, even though testing is usually occurring at the college or university that they're coming from, but then also families wanting to get together, because a lot of them have not gotten together in 6 or 7 months, and so we're hopeful that people will be smart for Thanksgiving and we don't see a spike in a couple weeks. I think we're in this second wave. We're looking at 6 to 8 weeks of activity, and I think the way the virus permeates, it's going to find places that haven't had it. That's why you're seeing the spikes in the Midwest part of the country, where earlier in the spring, March and April, we saw nothing. So that's why you're seeing the numbers kind of expand. If we can keep it a status quo here, our highest number, I think, was 35 at one point back in March, April for active cases. I think we'll be doing good. And I just want to emphasize the masking. We have a positive case in our department, and that individual worked with a couple people for 48-hour period, but we have a mandated mask protocol while working, and the other people that the gentleman worked with were tested multiple times and are negative and non-symptomatic. So again, we've had that happen a couple times. We've had positive cases, but because of masking, it does work, especially in an environment like ours. So I'm going to keep preaching that with the department.
So just to reiterate too, just as a reminder, as this goes on and people have become tired of it, the purpose of the masking isn't so much to prevent you from getting it, but to prevent you from giving it.
Correct.
So,
and CDC is saying both now. They're saying, hey, it does help preventing you from getting it also. And the way I look at this is, I hate wearing a mask, as does most people, I'm sure, but we're looking at probably 6 to 8 more months of increased mask wearing, and then hopefully we're on the backside of this a year from now with vaccines and the virus is on the downslide. But right now we have to, as annoying as it is, if we can just get through the next 6 to 8 weeks, get through some of the second wave, prepare ourselves for a potential third wave, because you've read the book, and I have also, on the 1918 pandemic. You see it in spikes, and then by summertime we can have this in the rearview mirror, at least a significant portion of it. I'd be happy.
Yep. So as far as the mask wearing, the governor did put a new mandate order in place requiring mask wearing in public places, and that does mean just, if you're at the golf course, if you're walking downtown, or just even when you get out of your car. A lot of people have been jumping out, waiting till they go into the store or the restaurant. You're required to wear it all the time now, wherever you have the potential of impact with people at that point. So you should be better prepared for that, because as we spoke to, it does work. Just a quick jump to college kids coming home. With the towns put out a guidance and just some thoughts of how to get your kids home safely from college. I have a daughter who's down at school down in North Carolina, and I've already had that conversation with her. She's at Duke University, and they're actually adjusting their testing schedule to when people are leaving, so that you can then say, I'm leaving on this date, and they'll accommodate when to test you prior to leaving, because Massachusetts does have that travel mandate of coming back into the state, of testing 72 hours prior to arrival or quarantining 14 days after arrival. So have your student reach out to the school and find out what is being offered through the school in order to get your student home safely.
A couple things also, Dave, I'll add on testing. Few things. The county and state had money put aside, and it looks like that money is going to be released. And I think the goal is drive-through testing sites. So we're looking at, that capability that'll be out there for people to be tested in a drive-through format. Whether there'll be a site in Sandwich, I don't know, but we have exercised one twice with the drive-through flu clinic, and we did that for a reason. But there is money out there, so hopefully there'll be increased ability to test. We are working on believe it or not, a teacher testing reentry program for after the holidays. The test kits are on their way. The antigen test kits, we're going to have antigen, nasal PCR, and antibody testing, again, available for teachers as they reenter after the holidays. We have enough antibody kits that we are testing town municipal employees, like I said, every 120 days. And the 500 antigen kits that are coming in will be able to test municipal employees who are symptomatic right away, followed up by a nasal PCR. So our testing platform is coming together. The issue is access to it, but again, we've set ourselves up. We have a private lab that we're doing our nasal PCR testing. We have an agreement with BI Plymouth for public safety folks to get rapidly tested. And again, any town employee that is symptomatic, we have the ability to test them. And we also encourage them, don't come to work if you're not feeling well. And then the other thing we are working on as the COVID team is remote work. We brought this up earlier in the spring, and you may see some town employees working from home on a rotating basis just to practice in case we have to go fully remote, that we have that squared away. I've kept the fire department secretary home 2 days a week this entire time to make sure her skill set is good for remote work and she can access everything. So we're doing everything we can to line ourselves up to continue the continuity of government. That is my big thing. That is what I teach. That is what I research. And I'm hopeful that we can keep things moving forward as we have since the 26th of May.
What's interesting is that desire to test and have them rotate out to work from home. The town employees, or at least up in my office, a lot of them don't want to go home. Yeah, because their kids are on that rotating basis also. So they're willing, they're holding off for as long as they have to at this point. So, but they will be rotated out just to test everything also.
And again, I think it's a validation of the personal protective equipment and the policies that were put in place in May. That are validating. People are very careful. They're, hand washing. They're wearing their masks in town offices. And again, it's the incentive to keep things open and keep things moving. Yep. And nobody wants to see a reversal and going back to lockdowns the way it was. We've had very, very good compliance with town employees who've been upfront and willing to listen and to train, and they understand. Again, you go to other towns in the Commonwealth here that are not open. People can't believe you can't go in and get a building permit live. Right. Walk in and see somebody. So I give a lot of kudos to the frontline municipal workers who have been out there since the 26th of May working in these conditions and following the protocols and policies set forth.
And we'll give a shout out to the staff at the school too, Pam Gould's staff, as far as the efforts. It's a daily conversation as far as identifying the cases out there, working with them relative to getting kids, students or staff set up as needed remotely, and it's been working well. So
remember, our goal was Thanksgiving. Yep, we're not going to say we're there.
No, a few more weeks.
More weeks, but we're heading in that direction, trending in that direction. I know my kids have been happy that even if it's been a hybrid model where they've gone in 1 or 2 days a week, they have the ability to go in and interact. I think that's an important piece.
Super. So I think we're going to resume these weekly PSAs just as things seem to be ramping up, and we know people watch the news and see what's happening in the rest of the part of the country, so we're going to update you what's occurring in town here. So I guess as we, till our next PSA, start making your plans for Thanksgiving, for a safe Thanksgiving. We'll talk to you before then, but also start making plans to get your college kid home safely also. So let's try and protect our community, and we'll talk to you soon.
Thank you.